Today we are reporting 125 new cases of COVID-19 in the state of South Dakota. This does include 5 new hospitalizations and 2 new deaths, one among a Davidson County resident and another among a Minnehaha County resident. We have had 76 individuals newly recovered to the point where they are no longer able to transmit COVID-19. And we've had 1,686 new tests that have been reported to the South Dakota Department of Health. This does bring our COVID-19 case count to 10,691 cases. Of those, 1,269 individuals are considered active infections, and 9,265 are considered recovered. We've had currently a total of 53 individuals hospitalized. We've had 157 deaths, and the total number of tests that have been reported to the Department of Health is 169,767. This does include 132,108 unique persons that have been tested. For our cluster updates, we have Bethel Lutheran with 37 individuals recovered out of 43 COVID-19 cases. This is a correction from Monday's update. The other updates that I have, so in total, we have reported out less than 40 total cases among school children and teachers and staff. And so just wanted to let folks know that in addition to the total number of cases within those K-12 school settings, we'll also be providing an update to the website starting on Monday. The other update that I wanted to provide is just around the Sturgis Rally. So we do have 2 public notices that have occurred, and so that information, we have the One-Eyed Jack's Saloon and the Bump and Buffalo Bar and Grill, which folks are aware of if they're receiving our media notices. And that those are the only 2 public notices that we've had so far, but we have had less than 25 total cases associated with attendance at the rally, and that does include several cases reported to us from outside the state of South Dakota. So with that, I'll go ahead and open it up for questions.
Okay, we are now unmuting the line. First question, please.
Yeah, JP
Hi, this
from
is Ray from
KOR News Radio.
Please go ahead, JP.
Thank you very much. Regarding the reported infections among school children and staff, how many school districts does this include at this point?
So that number does include a total of 19 school districts with at least 1 case.
Thank you.
Okay, next question, please.
Ray from Killian.
Ray?
Yeah, with regard to schools and universities in contact tracing, is the DOH going to handle all the contact tracing from cases reported from schools and universities? And if so, wow, just how do you prepare for that?
So, Ray, this is Secretary Malcolm Risden. So the Department of Health will continue to investigate every positive case and identify those close contacts and make formal notification of those individuals. We are working very closely with the Department of Education and the schools, both K-12 and universities, to assist with gathering information to help us identify those close contacts. And so it will be a very very much a partnership in that regard, so that we can, hopefully notify individuals as quickly as possible. We're also working to ensure that we will have the staff needed to be able to keep up with those potential increasing numbers.
And just a quick follow-up, if I can. Will the definitions of close contact, when you think of a classroom, a third-grade classroom, or perhaps a classroom or dorm in university settings, will your definition have to change, or can it be fluid? I mean, how do you identify close contact in the case of a third grade student having it with 20 other students?
Yeah, and so you're exactly right that the definition does not change. It's still focused on that 15 minutes or greater duration for within 6 feet of a COVID-19 case. Now, there are other considerations, as you mentioned, around the level of mixing that we have in some of the younger elementary age students, the level of social interaction that people may have in older grades that might be, specifically in the school classroom or between classes, and then just how do people, go to school, and so whether they're riding on buses and so on. So, there are definitely a lot of moving pieces, moving components when it comes to conducting a case investigation and identifying those individuals who are close contacts. But again, this is the same process that we've been using, throughout the pandemic with other business settings and other situations.
Ray, I might also just add that some of the strategies and the mitigation factors that Dr. Clayton just alluded to, and kind of minimizing some of those encounters, are things that schools have been working on with their COVID-specific plans. So making, changes to how some of those operations work to help minimize the exposure of students and the spread of COVID.
Okay, thank you.
This is Morgan at the Rapid Speaker.
Go ahead, Morgan.
In the contact tracing for the rally cases, obviously the person who went to One-Eye Jack's may have been around hundreds of people in the 5 hours that they were there, and similar to Bump in Buffalo, I'm sure. So how is the contact tracing going for those cases?
Well, again, the whole reason that we needed to do a public notice for those cases is because the individual was not able to identify all persons that they may have been around that could have been considered close contact. So, as far as collaboration with the individual who tested positive, we do follow up with the close contacts that are known that may have been in a community or household setting of those cases, and we issued the public notice, to help identify areas where individuals may have been, where we have cases and where individuals may have been exposed, so that they can better monitor their symptoms, and if they do develop COVID-19 compatible symptoms, reach out to their healthcare provider for testing.
And then I have some other questions, and thanks for the update about how you'll tell us about the school cases. It'll be helpful, I'm sure, on Monday. But I wanted to ask quick if there are any cases in Rapid City schools that I need to know about. And then second, if I think we talked about this before, but will college students be counted as the county their school is in or in their permanent residence?
So, so what we'll be doing is not specifically releasing, individual school names as part of our updates. When we have issues where we do have larger exposure events, we'll issue them similar to the way we do with our public notices. The other thing that is important to remember, and especially around those college-age students, is that as they're seeking care, whether that's, in the community in which they're going to school, or if they're either commuting or happen to be back at home at their permanent residence, while they're on a weekend or something like that, all of those cases do come to the South Dakota Department of Health, to the location where the student is residing while they're going to school, college or university. So we do get all of those notices, even if a person may use their permanent residence while they're being tested in another state. We've had this happen recently, where they were tested in another state. They tested positive. That state notifies us of the case because it's counted as morbidity for the state of South Dakota. And then we work the case and help identify identify any additional close contacts that need to be notified for the time that they spent in the community in which they go to school. So this is a process that, again, is in place and we use for other diseases as well. And so it has worked. I could say that we've already had cases where that is the case.
Next question, please.
Jack Cottle with KOTA.
Go ahead, Jack.
With cases trending upward here in the state and large groups of people convinced this is either, the whole pandemic is either a hoax or overblown, in your opinion, how much does that factor into the rise in cases that we've seen here?
I do think that, individuals need to make sure that they're taking proper precautions. And those that are taking those precautions, are more likely, to be maybe up to speed with everything that's going on around COVID-19. Some of those individuals individuals who choose not to wear a mask, it doesn't mean that they aren't aware of the literature out there around the use of face masks. What I would say is that, as time goes on, as people see other things happening, activities that they would normally normally engage in, I think that that provides a level of normalcy that is good, but not to the level that we want individuals to slip into not taking precautions against COVID-19. So I think that's probably a good reminder for all individuals that, when you're, as kids are going back to school, as college students are going back to campus, that we want to make sure that individuals are doing so safely. And just because they may have started the school year last year in a different manner, we want folks to take proper precautions, washing their hands frequently, avoiding large crowds, making sure that they're, if they're in a crowd, that they're wearing a face covering, and doing the things that they need to do to protect themselves.
And Jack, this is Secretary Malcolm Reisden. To your question about people that don't believe COVID is real, I don't think that we've necessarily encountered individuals where that's been kind of the issue, and that's what led to these increases. But certainly, if people are out and about more and if they're coming into contact with more individuals, that we're expecting to see more cases because of that kind of activity.
Next question, please.
This is Stephen Groves.
Go ahead, Stephen.
In the last few weeks, we've seen a bit of an increase in cases, and I was wondering, if the Department of Health updates their modeling or their possibility of scenarios based on that, and if you could tell me, over the last few months and looking at this pandemic as a whole, if you have any idea as far as where we are in terms of, getting through this, working out herd immunity, or just any type of timeline that has been updated as a result of the data that's come in over the last few months.
Well, Stephen, I'll just remind you and others that the initial modeling that we were doing as a state was geared towards ensuring that we would have enough hospital and healthcare system capacity to be able to treat people who might become ill with COVID. And so, as before, that modeling and the work that we did then, preparing for worst case scenario has been completed, and so we haven't had to re-up the modeling for that purpose. Again, if today we've got 53 individuals currently hospitalized from COVID, so we are well within current capacity across our state. This is really not impacting our hospital capacity to a large degree. So the other thing I would just point you to is the website, where we have greatly enhanced our data reporting on trends and other information, so that communities and individuals have the latest information, including historical information on trend lines around positive cases, positive test rates.
We have time for one more question. I have the last
Hi,
question.
Whitney Fox with Land News.
Lisa, please go ahead.
Just wondering, what is the reason that you're not going to be releasing the names of the school districts where there are positive cases?
So we do work very closely with the schools, and the schools will be issuing notifications to the students and the parents, when there are cases identified within the school settings. That's information that is, pertinent to those who are impacted by COVID-19 within that community. And so we're focusing on reporting the data at a more aggregate level, at the statewide level, so that there's some understanding of total number of cases, total number of school districts, but the focus that we have is making sure that the school districts are able to provide that and be a source of information for those parents, and we continue to provide pertinent information that's focused on all South Dakotans and what's going on as a view into what's happening in the school setting.
We would like to thank you for joining us today.
I'm so sorry.
Sure.
I was just wondering, have you guys finished contract tracing for these 2 cases you put out public announcements about? And then I was also wondering, when you say like 25 total cases associated with attendance at the rally, are these people who got it while they were at the rally, who were at the rally and they already had it? And then just, last thing would be how many people do you believe have been exposed by the cases that you know of?
So, what I can say is that we are reporting individuals who had attendance at the rally in the 14 days up to their illness onset. And so, while an individual may have attended the rally, that does not mean that those are individuals whose only exposure was at the Sturgis rally. So that is a point that I do want to make. The second is going back to that first part of your question, which is we have less than 25 cases. So it's not 25 total cases. It's less than 25 cases. And the number of individuals who are exposed, that again, that's essentially the definition of when we do public notices, when we are not able to identify all of those individuals who have been close contacts to a confirmed case. And so the number of exposed is unknown, but you can anticipate that we are doing public notices for those in all of those circumstances where we have where we lack information about individuals' exposures, their close contacts, so that those who may have attended the rally or attended the specific business know what's going on and can take the proper precautions, including getting tested for symptoms.
So, what about, so there have been 2 public notices, but for the rest of these less than 25 cases, does that mean you were able to identify all the contacts?
So we do work, either us or the state in which the individual resides does work the close contacts for those individuals. And so, we've only had 2 instances so far where we've not been able to work with the individual to identify all those close contacts.
Okay.
Got it.
We are out of time for today, and we would like to thank you for joining us today.